Well, hello, everyone, to the official launch of Healing Healthcare, evidence-based strategies to mend our broken system and think differently by design. Whether you're joining us live or catching the recording, we are thrilled to share this moment with you today. We're not just celebrating the book, we're celebrating a movement. This book brings together the wisdom of leading voices in healthcare and beyond, and each contributing unique perspectives on how to heal and transform our broken system. But before we dive in, a quick housekeeping note. We have a special prize for the first 3 non-contributors who order the book and write an Amazon review by November the 2nd. So stay tuned for more details. Now let's jump into the heart of why we're here today. Sharon, to you.
Sure. I've been in healthcare long enough to see its beauty, its resilience, and yes, its flaws. This book is not an academic take, it is personal. It's a call to action that is based on lived experiences, practical wisdom, and evidence-based research. It addresses burnout, innovation, and how we can all move forward with purpose. This is a collection of 26 brilliant minds who have shared their expertise and their personal insights to light a path forward. Each voice brings something very unique, and together they paint a holistic picture of what it will take to truly heal our healthcare system. We're going to start off now with Bonnie Barnes, who will share a personal story and the outcome that brought her to this book in the first place. Bonnie? You're muted.
Of course. Got me now? No.
Yeah.
You're good.
Good now? Okay. Well, first of all, thank you so much for including my husband and me in this incredible opportunity to share our call to action with the nursing profession. You know, when we started the Daisy Foundation 25 years ago, I could never have imagined we would have anything to say to nurses and healthcare leaders about strategies to help heal healthcare post-pandemic. I had spent about 30 years in marketing and advertising, and in all that time, I worked with dozens of consumer brands and not one healthcare organization. But then our Patrick died, and my husband, Mark, and I immersed ourselves in our mission to say thank you to nurses for the extraordinary compassionate care we experienced at Patrick's bedside throughout his 8-week hospitalization. And as the Daisy Foundation's recognition program has grown, now partnering with over 6,800 healthcare facilities and nursing schools in 41 countries, suffice it to say, we have learned a lot about healthcare and about nursing in particular. And we've gotten to know nurses, and our respect for this profession has deepened profoundly. And it's a respect we're determined to spread to the public and that we want nurses to feel for themselves. So as our contribution to this wonderful book, we offer 3 calls to action. The first is a call to action for nurses. Mark and I have participated in, hundreds of Daisy Award presentations over the last 25 years. And at each presentation, the nomination for the honoree is read to this gathering. And it's a nomination in which a patient or a family member or colleague has poured their heart out, describing the extraordinary impact a nurse has had on a patient or a family member. And at the end of virtually every one of these presentations, the nurse who's honored says something like, "I didn't do anything special, I was just doing my job." Those words we are trying to get eliminated from nurses' language. So we urge nurses every day to take a few minutes to reflect on the incredible difference you make to patients and families. Just take it in. And stop denying the gratitude that's being expressed to you anytime someone says thank you to you. Please don't take away from us, your patients, what it means to us to tell you what a difference you've made in our lives with your care. The second call to action in our chapter is to nurse leaders, and it relates to the public. Please reach out to the public in your communities and let them know how much their appreciation and their respect for nurses mean to the nurses who care for them. By demonstrating their gratitude, members of your community will help support nurses' well-being and, really importantly, help keep them committed to nursing in their communities. Please make the stories of the extraordinary care your nurses provide public in your local media so their neighbors and others can see what your nurses really do and, importantly, who they are. More than 3 million Daisy nomination stories have been written so far, and frankly, to us, it's just not enough. We know patients and families are grateful. We just need to urge them to express that gratitude for care in a demonstrable way, and we need to make it easy for them to do so. And finally, we offer a call to action for compassionate care. As our friend Christy Dempsey, a fellow author in this book, will confirm, compassionate care is not a soft skill. It's part and parcel of what nurses do every day and of who they are as people. No profession combines clinical excellence with compassion like nursing does. We at Daisy continue to drive the importance and visibility of compassion as revealed in these Daisy Award nominations that describe what patients truly value in their healthcare and in their healthcare experience. It is so much more than the successful insertion of an IV into the arm of a frightened child. It's also about the nurses singing songs from the movie Frozen to distract and engage the young patient and hopefully make that child more comfortable. It's much more than helping a woman deliver her baby successfully when the newborn's grandfather lies terminally ill in the same hospital. It's also about assembling a team to bring the new mom and baby to the grandfather's room so he could hold the baby one time, just hours before he died. And it's much more than educating a patient on what it will be like to live with an ostomy bag. It's also about doing so while sitting by the patient's side, holding his hand, answering as many questions with patience and with presence, and helping him know his life will go on. So soft skills, there's nothing soft about combining clinical excellence with patient advocacy, compassion, sensitivity, and kindness. Nurses know how to do this. Leaders just need to give them the time and the permission to do it. So I hope as you're reading Healing Healthcare and learning from the very important solutions that we are seeing in healthcare's challenges, please keep in mind these 3 calls to action: to nurses to reflect and take in the difference you make every day, to leaders to engage the public and help them understand their very vital role in nurses' well-being and retention, and to everyone, please keep compassionate care for patients and families front and center. As I said, compassion is not a soft skill. It's foundational to healthcare and to caring for others. I can't thank you, Sharon and Dina, enough for inviting us to share our perspective with the many thousands of people I know will be buying and reading this book and applying its many lessons. We are really grateful to both of you.
Well, Bonnie, all I can say is amen, because I think that's truly the message we want to get out there. So well said. And I want to thank you for opening this session because it's very important. So thank you, Bonnie. We really appreciate you very much. Thank you. Healing Healthcare is divided into 3 unique sections: workforce, well-being, and wisdom. And I want to take a moment to acknowledge the voices who helped shape this book. Each contributor has brought their own experience, wisdom, and strategies to help us reimagine what healthcare can and should be. They'll have about 5 minutes to share some of their ideas, and we're going to start with workforce. So Joe, I know you're here with us, so we're going to start with Joe Tai, who's going to talk a little bit about values. Joe, up to you.
Well, thank you. And first of all, Sharon and Dina, it's just an honor to be a part of this book with my fellow co-authors. It's really never been more important. And in my chapter, I focus on the importance of creating a culture of emotional safety. In her chapter, Christy Dempsey talked about how important it is for people to feel engaged in the workforce, in the work that they're doing, but that requires a culture where they feel safe. And one of the things that I've been thinking a lot of, 2 of the things I've been thinking a lot about since, especially the pandemic, first of all, is that we very much want to move on. You know, we want to say we don't have to wear masks anymore. The pandemic is behind us. But just as the disease COVID has left a lot of COVID long haulers, people with chronic physical conditions, the pandemic has left a lot of emotional long haulers. And, you know, PTSD often takes years before it manifests. And I do worry that we as leaders want to move on. We want people to put it all behind us, and we have to assess continuously how people are doing. And over the years, there has been a lot written and studied about psychological safety. Amy Edmondson and others have written about it. Psychological safety is so important, but it is about the organization, not the individual. Psychological safety is feeling confident that you can stop the assembly line, that you can call a timeout in the operating room, but it is to prevent the sort of errors that are harmful to the organization. You know, it's the foundation of just culture, but it is feeling like I can stop the assembly line or call a timeout without fear of retaliation or humiliation, even if the error is my fault. Emotional safety, on the other hand, is about the individual. It's creating the kind of environment where I, as a nurse, I, as any healthcare worker, feel like I am being protected by the organization from the things that cause emotional harm, from obviously physical violence, but I'm being protected from bullying. I'm being protected from toxic emotional negativity. And what the research shows by Gallup and others is that we're not doing a very good job on that. And so one of the things in my chapter, I outline 8 strategies for how do you create a more positive emotional culture. And those work interactively, they work together. So for example, 3 of them. One, I think you have to start by creating the kind of environment that is intolerant to toxic emotional negativity, where we're not being held accountable by the boss. We're being held accountable by each other. People say, you know, we don't treat people that way in our organization. And one of the ways you do that is by creating rituals. Many of the organizations that we've worked with have incorporated things like the pickle pledge, which is a very simple promise that says, I will turn every complaint into either a blessing or a constructive suggestion. But they incorporate that into staff huddles where everybody says it together. And at first you're saying the words, but over time they start to sink in and you start to say, well, I think you're being, I think you ought to put a quarter in our pickle jar. And those rituals establish a setting for the kind of things that Bonnie was talking about, where we can recognize each other for the contributions that we're making. We can talk about the challenges that we're facing. We can create the kind of environment that really provides meaningful recognition for the work that we do. And so the last thing I want to say about this book, Healing Healthcare, is so important for us to appreciate the interaction of the individual and the organization. And, you know, the structure of this book has lots of advice for me as an individual to be a better leader, but also advice for me as a leader on how do I create a more positive culture. Mm-hmm. And those things work together. Personal values and organizational values have to support each other. Mm-hmm. So it's been a privilege to be a part of this party. And I'm looking forward to seeing you sell 1 million copies of this book, because it's never been more important.
Thank you so much, Joe, for your so important, information. When talking about psychological safety, it's paramount. The organization has to create it. There is an individual responsibility, I think, towards creating that, right? And so we've got those strategies. So thank you, Joe, for sharing those. And I want to send it over to Sharon now to talk about the next topic.
Sure. Our next topic is well-being. And we were going to hear first from Anna, but we're going to hear first instead from Anne Llewellyn. Anne, take it away for the next 5 minutes. They're yours.
Thank you. And congratulations to the group of nurses who put this book together, as well as Sharon and Dina for their leadership in helping us to put it together, as well as spread the word on it. They have really given us so many great resources that will help us all spread the word. So tomorrow is the release date, and hopefully we will sell 1 million copies. Would be great. My topic or my chapter was taking care of you. And I just think it's so important. All of us who are healthcare professionals, we take care of other people. But if we don't take care of ourselves, we cannot take care of other people. And so our well-being, our health, our mental health, our physical health, our social health, the impact we have with our families, if that all isn't working, we can't take care of other people. We're not going to be happy. We're going to be miserable. We're going to be resentful that we're doing what we're doing. So the fact that, we used to kid about, I'm going to take a mental health day. Well, maybe we should tell people, take a mental health day, because we need mental health days every once in a while. And, I don't think this is a new topic. This is something nurses always have been, we don't take care of ourselves, period. So the fact that, we now have an epidemic of people burning out, it's just because we've ignored the problem for such a long time. And now it's at a head because we have shortages, we have people leaving the profession at record paces. So I hope my chapter will help people just realize the importance of taking care of ourselves, because we can't do anything if we don't take care of ourselves.
Exactly. Let's turn it over to Sue Johnson. Sue?
Hello, I'm also in the same section of the book, and my topic is making well-being a reality. And I fully agree with Anne. We have not taken care of ourselves for many, many years. But our organizations also have a responsibility and an accountability for the nurses they employ to ensure that they have an opportunity for well-being. Now, that may be a variety of areas that they look at. We have a lot of places that do rooms where you can relax for a few minutes. We have some that do massages. There are all sorts of techniques that people can use. And please understand, we are all different. Well-being for each of us is different. For some people, it's mindfulness. For others, it's coping strategies. I love to write. I can write and it relaxes me. Certain other people can't and they need peer support. But I'm going to give you one thing that you can do, regardless if you've never done it before, to enhance your own well-being. It's called the 3 good things. It's easy. You simply take a pencil and a piece of paper at the end of every day, regardless of what has happened, you write down 3 good things that have occurred during the day. It may be the car started when I got to it. It may be I made it to the unit on time. And it may be something, a compliment that you got from another nurse, from a physician, from a patient, or a family member. Write those 3 things down, keep them. At the end of 6 months, you will find that you feel much better about your own mental health and wellness. And as you look back on those, you can remember on certain occasions, this happened. Wow, I had a terrible day with all sorts of things going wrong. Look what I put down here that was a good thing that happened during the day. You can do it every day. Don't share it, keep it for yourself, but you will find after a little while that you feel much better, even in the bad times, and we will still have some of those. So try to remember, if you don't do anything else from my chapter, think of 3 good things, jot them down, and live with them. Thank you all so much. I am so pleased to be a part with these colleagues. This is a fantastic, I've been a nurse for 58 years. And this is a fantastic thing to have happened in my career. I salute all of you. I am so proud to work with each of you. Thank you.
I think we're one of your 3 good things. Let's turn it over to Anna. Anna Dimension.
Do it.
Hi, everyone. Like the other authors, I'm privileged and honored to be part of this book launch. Really enjoy the process of putting some of my learnings from the pandemic period into the chapter, some of the experiences as a leader that we learned in the health system and what benefited from the leadership perspective, getting involved, really doing learning and sharing and being supportive of our bedside nurses. But what I want to talk about from the chapter, the well-being piece of it, I shared my personal experience of going through that journey and how giving a voice to our experiences, because a lot of times the public does not know what we do as nurses, and our ability and perspective really offers unique insights. The pandemic highlighted a lot of that work, but again, we've sometimes go in the background and people don't see our perspective is important for policy, for making important decisions at the hospital health system level. So some of my reflections, I talk about setting goals individually, and I share a table about annual goals that you can do for your career, community, finance, and physical and social, and some of the examples of how to do this to be more visible, to be proactive, and really get yourself into this continuous improvement idea that, you know, we're all in this improvement, continuous improvement cycle for ourselves. As you might know, I come from a quality improvement perspective. So individualizing that personally and making goals that align with your values and checking in every so often to make sure that you are achieving what you're set out to do, increasing your well-being, your experience in education, as well as prioritizing, because all of us are super busy and there's so many goals to achieve and priorities to achieve. On a personal note, like I am a new mom, I have a 4-month-old, so this has become really important in my daily life of how I prioritize my goals. So there's recommendations of a matrix map of looking at your goals and specifying what your major goals are to prioritize first. What are things that are minor goals that you can do later, or some things that you can collaborate with others or delegate to others, and then things that you can eliminate. So it's really achieving your best, your excellence, your well-being to be able to contribute then to the community you're part of, to the work environments you're part of, and being solution oriented. So thank you so much for being here, watching our sharing of each chapter. I look forward to hearing more from others.
Thank you. Back to you, Dina.
You know, I would like to just kind of pull Ian, are you with us here?
Hi.
Yes.
Hi, Ian. I would like for you to just talk a little bit because you are part of the well-being as well. And I would like for you to speak about, you know, how do you create this sustainable resilience? It's such a beautiful 2 words, but how do you do that? So I'd love for you to just speak on that.
Well, my involvement in this project really started when I received a message from Bonnie that we all respect, right, from the Daisy Foundation. And she asked me if I wanted to participate in this very special project. And her being a longtime supporter of the American Association of Men in Nursing, where we were just at the St. Louis for our 49th annual conference. And I really had the great opportunity of meeting you and Sharon in person, and really didn't hesitate, like you amazing leaders, that I would want to be a part of this, right? But in my chapter of fostering sustainable resilience, like you said, in nursing leadership, I emphasized on the importance of integrating well-being into nursing leadership in practice. So I could say the main takeaway from my chapter is that well-being needs to be at the core part of nursing leadership. It needs to start from each of us. We must model the self-care to create an environment where our teams can thrive, right? By prioritizing the well-being of leaders and healthcare professionals, we could really truly transform organizational culture and ensure sustainable resilience for the future of our profession. And I believe that the live experiences that we have had all the past few years have truly opened our eyes to the critical need for resilience and well-being. And the challenges that we face as healthcare professionals have made it really clear that fostering resilience isn't just important, it's really mission critical for our profession. And that's why it's my hope that our book, Healing Healthcare, is so crucial that it will really reach as many hands as possible. And I promise to do my part and campaign as hard as I can, because my really goal is if every nurse that I know that in my network will need to have a copy of this, because it's really important. But I'm truly just grateful to have the opportunity to be part of this special project.
We are honored just to have you, because we spent time with you last week and we see the power that you have and just your heart, just to be able to serve and be such a great connector and helping people with, some of the strategies in the book. So we want to thank you for being a part of our journey. We think you're awesome. So thank you for joining us. And thank you, Bonnie, for
Thank you.
asking Ian to join us. So we want to jump on over to the next section, which is the wisdom section. That's where we glean from the classroom to the clinical space as shared only by 3 people here. We want to go ahead and reach out to Melissa Birdie to speak on her wisdom chapter. So Melissa, what would you like to share?
Well, good evening. Thanks so much, Dina and Sharon, and to all of our colleagues here tonight. I am so grateful to be a part of Healing Healthcare. When we think about the book, it really, as our colleague Joe mentioned earlier, the pandemic, COVID, it really fractured our health system. But I think along with those fractures, it gave us opportunity. That's what I'm most excited about, is to talk about opportunity to fix from a structure, a process, an outcome, a person perspective. Really looking at my section was around being intentional. And so this is an opportunity for us to pause and really think about how we operate, how we function today. What do we need to look like for the future? How can we reflect? How can we learn from all of the things, especially over this last, 4 to 5 years? And so when we think about nurses, I think what I really focus on is that we represent the largest aspect of healthcare. Our voice is so, so important. And that's what I'm most excited about with this book, because it gives us an opportunity to share, as one of our colleagues mentioned earlier, not only lessons learned that may impact an individual, but lessons learned that may impact health systems. And I think that's where we are on a path to really create some change. I think one of the things that I think about is our need to be investing in our nursing leaders for the future. And so this book offers such great advice, from mitigating burnout to promoting a culture of well-being to establishing a healthy workplace, and really thinking about the wisdom that certainly everyone in this room has gained throughout their careers. And so in my chapter, I offer opportunity to reflect pearls of wisdom. I encourage the readers, anyone that has an opportunity, to really think about what your pearls of wisdoms would be. As you reflect on your experiences, your career, what would you do differently? What would you do more of? Taking that opportunity to be intentional and replicate the successes, and really learn from things that and the experiences that we've gone through. So I would say that's really what I'm most excited about. It was such a pleasure and a joy and a privilege to write alongside each of you. And thank you so much for this wonderful opportunity.
Thank you, Melissa, for joining us. And now I want to go over to Christy Dempsey. Christy, would you like to share a little bit about your chapter?
Yes, thank you, Dina. And I have to say, I'm so honored and humbled to be a part of this group. So many of the people who have contributed to this book are friends as well as colleagues. And so it was a wonderful experience. The healing healthcare assumes that we have healthcare, and we don't really have healthcare. We have sick care. So this is not just a book to heal healthcare. This is a book to get us to healthcare. And I think that is something that we should actually, as contributors, be really proud of, right? I think that this is a book that will serve as a resource for leaders, not just nurse leaders, but leaders, to get us to healthcare rather than staying in sick care. So my chapter was part of the wisdom part of the book, and it's a 360-degree lens that connects the dots between workforce, well-being, and wisdom. And my experience as the first chief nursing officer at Press Ganey allowed me to look at the data that supports all of the things that we're talking about. So these are not just concepts, and this is not soft science. All of the things in this book are data-driven and evidence-based. And so that to me is what's so important. And we need to remember why we got into this business in the first place. And especially with COVID, we got a little jaded. And I think we need to remind ourselves why we're here and the impact that we have on the lives of the people that we take care of and the lives of the people that we work with. Bonnie said it earlier, and I think it's so important. I've often said, we might see somebody in the grocery store and recognize a face, but they will remember everything we said and everything we did forever. Because we have interacted with them at the most vulnerable time of their lives. And we need to remember that impact that we have on everyone's lives that we come in contact with. And so getting back to the why we do what we do. And it goes back to what Joe talked about in terms of safety. You know, safety is at the bottom of Maslow's pyramid for a reason. And you can't get to belonging, which is an intrinsic motivator that we need. You can't get to belonging. You certainly can't get to self-actualization until you feel safe in what you do. And if I'm in the emergency department and I'm being threatened and hit every day that I'm at work, I certainly don't feel safe. And so I can't feel any of those other things either. And so I think we need to get back to the why, make sure that people feel safe doing what they do best so that they can have that feeling of belonging and want to stay and want to continue to provide health care and not sick care. So sell 1 million books, sell 2 million books. It's good stuff.
That's our hope. Thank you so
From
much.
your mouth
Christy.
to everyone else's wallet. Thank you, Christy.
Thank you. Now I want to go over to Kathy Catrimbone. Kathy, would you like to share a little bit about yours?
Oh, I would be delighted. Thank you so much. And as everybody has said, Dina and Sharon, thank you so much for the opportunity to be a part of this important book. And my chapter focused on three important points, and it really built upon, actually similarly to some of the things that Melissa spoke to. But I'll start off with saying, as everybody has echoed, that it's really been an unprecedented and challenging time in nursing and healthcare given the impact of the pandemic. And I think it's really an important time in our history that we take the time to reflect upon our commitment to the nursing profession and to healthcare. And I think whether you're a newcomer to the profession or experienced, I think there are three important steps that I would encourage people to embrace. And they are: discover your passion, be intentional about your journey, and put yourself at the table. And I think in terms of passion, I think it's really important that that you take the time to reflect on what brought you to nursing and to healthcare, and what difference do you want to make in it. I mean, we all only have 24 hours to our day, and it's an important time to take a step back and really reflect upon that. And when I look at my own career, I knew early in my career that I wanted to be a leader, and whether it be at the national or international level. And after having attended many conferences, I realized that the organization that resonated where my values were was Sigma Theta Tau International. And I realized at that time that that was the organization of choice that I would like to spend, commit my time and energy to. So and what really spoke to me was their World Health Mission. I thought that was very important in the contribution that I wanted to make. Be intentional about your journey, and then to sit down and map out your journey and decide, what are the incremental steps that you want to take And where would you like those steps to take you to? And again, reflecting on my own journey, I realized that I took the opportunity to talk with regional and international leaders within the organization, and then mapped out a journey. And knowing that you have to have that vision and then see where that takes you. And my journey went from being a regional chapter coordinator, working with leaders at the in Illinois, Missouri, Pakistan, Brazil, which is where I started, then moving up to actually being the chair of that group and helping support those leaders, working with the chapter presidents around the world, then from vice president to president-elect and president. And my call to action at the time was influence to advance global health and nursing, and focusing on the areas of leadership, policy, advocacy, and lifelong learning. And then putting yourself at the table, after having those experiences, and then in my term as president, putting myself at the table and having the opportunity to work with other world nursing leaders to promote the profession and healthcare. And experiences like with meeting with Elizabeth Iro, who is the Chief Nursing Officer at the World Health Organization, being part of the leader in the Global Nursing Summit in Geneva, Switzerland, where leaders from around the world came together to talk about opportunities for the different organizations for collaboration. And then another example, the Global Advisory Panel on the Future of Nursing and Midwifery, where we established a voice and a vision for the future of nursing and healthcare. So again, just to kind of reiterate, discover your passion, be intentional about your journey, and put yourself at the table, and take the time and the energy to reflect on that, to have the strongest influence you can as a nurse within the environment that you're living in. So thank you.
Well said. Thank you so much, Kathy. And as we all say, grab a chair and get yourself at the table. That's got to be the goal. Right. So we had such a great reception with the book, and we're so excited to be launching Healing Healthcare. And this week, we're going to be in Columbus, Ohio at Ohio State University Wellbeing Conference. We cannot wait to be there. We all leave tomorrow morning. So Sharon and I are super excited to be there. Next week, we'll be at the Magnet Pathway Conference in New Orleans, and we'll be there over with Melissa in her booth. So we're very excited, and thank Melissa for inviting us there. November the 7th, we'll be at Rush University in Chicago. November the 14th will be in the DC area. November the 25th, there are 2 sites there in Worcester, Massachusetts. So we're really excited about that. And after the first of the year, we're going to be obviously here in Missouri. We want to go to New York and California and beyond. So we're just starting this amazing journey that we're on. And we want to invite you to be at one of these events, and make sure if you have an opportunity, I don't care who you are, even if you're not in healthcare, buy a book for the person that takes care of you. Give it to your healthcare provider and ask somebody to buy it. So make it something that is, a gift. We've got a Christmas coming up as well. So next I want to go over to Sharon.
Okay. And Anne just asked a question, will we go to Florida as well? And the answer is yes. We will eventually wind up in Florida as well.
Yes.
Okay. After the hurricane season. All right.
Cleaned up, right. Yeah.
Okay. We want to hear from you. We have lots of guests on the line. We want to hear from you. What is the one word, and this can include everyone, even the contributors. Write the one word in the chat that comes to mind after what you heard today. What is it? What is the one word that comes to mind about healing healthcare? And maybe that word is sick care, as Christy so well articulated, but what is the one word that comes to mind?
Mine is hope.
Oh, you're supposed to write it in the chat. Write it in the chat. We're capturing them, okay? But I'm glad there's hope. So if you just take a second and write in the chat. And then we invite each of you to share your feedback on social media using the hashtag Healing Healthcare. And don't forget our special offer. The special offer, if you remember, was that the first 3 non-contributors to order the book and leave a review on Amazon by November the 2nd, hopefully that will be a positive review, will win a special prize, and it will be an Amazon gift card. Today's comments represent the heart and the soul of healing healthcare. The key message is this: the future of healthcare depends on each of us, whether you're a nurse, a physician, a policymaker, a technologist, a concerned citizen. Together, we have the power to drive change. So here are the top 3 takeaways from this incredible journey. Number 1, healing starts with us. We must care for our healthcare workers to build a sustainable system. You heard it over and over again from everyone who spoke, and even those who didn't have a chance to speak, like Brent and Kim, the same message: we must take care of ourselves. Number 2, innovation is personal. True transformation happens when we align cutting-edge technology with a human touch. The human touch that Bonnie articulated so well when she started us off. We must feel and have that human connection. Without it, we have nothing. Collaboration is key, whether it's across disciplines, generations, or leadership levels. Working together is the only way in which we will succeed. So we want to take this opportunity to thank each of you for joining us today. And remember that healthcare isn't just something that we receive. It's something that we shape. So let's continue our journey together, one chapter at a time, and let's all be sure to visit and share with our colleagues healhealthcare.com. And before I close, now that we have a few minutes, Brent, would you like to say something as well?
Well, sure, Sharon, and thank you, and congratulations to you and Dina. And it really was a true pleasure to get to work with these fine authors. I did part of the workforce, and I'm an advanced practice nurse, so I got to share the history of advanced practice and how nurses have continuously risen to fill gaps in care, and what that looked like historically, what it looked like during COVID, and how that shapes the future. So it was just a joy to write, and it's just been fun to be a part of this. Thank you for the opportunity.
Thank you. And Kim, before I share the words that are there, go ahead.
Yes, this really is an honor, and I thank you so much. And I strongly echo the words that Christy said, because we don't have a healthcare system. We have a disease care system, and we wait till you get sick and then try to fix it. Yet all of our parents taught us an ounce of prevention is worth a pound of cure. And why do we not put that into healthcare? And I really believe that's why so many nurses are frustrated, because we are taught wellness, looking at the whole picture, and then we get thrown into a medical model that's just disease care. You know, what's your diagnosis? What medication are we going to give you? So if we could just unleash the power of nursing and create these nurse-run clinics all over the country and really focus on wellness from a mind, body, spirit perspective, looking at the whole picture, imagine how we could transform healthcare in the whole entire U.S. It just makes me so excited to think about that.
It does. It does.
You're doing
It really
it, Kim.
does. So some of the comments in the chat: a new structure of healthcare based on wellness, nurse-run clinics, healing for all, passion. We can do it. Thank you. You're welcome, Joe. Thank you. All nurses are leaders, and we can create a bright future. And of course, hope. We have hope. We have hope for the future. Dina and I repeatedly say that those who will be caring for us are currently either in elementary school or middle school. If we don't encourage them to be nurses, we will have no one. So this profession has to be so engaging and so enriching and so positive, so filled with the joy that brought us to this profession, that everyone wants to be a part of it. There is no question. And I'm going to leave you with a thought. Dina told you where we're going and where we'll be. If you have colleagues in the Chicago area, please send us their names and we'll send them a special invitation to the program at Rush University. We do need to have a head count because we also have catering in mind. And so when we have to fulfill that order, we do need to know how many people we're ordering for. The same thing is true of the event that's in the DC area that's actually in Vienna, Virginia. And it is hosted by our publisher, Amplify Publishing Group. We'll be serving a light dinner there as well. We'd love to have all of your guests from the area come and join us. Karen Drinkard from AARP will be joining the platform. And today, your friend and mine, Ian, and now Dina's, Billy Mullins, from GW also offered to share some remarks on behalf of a School of Nursing. So we have others who will be joining us as well, but again, we need to know not necessarily names, but at least head count so that we have enough for everyone to go around. This is a great opportunity to get in on the ground floor of something that will be so big that, as I shared on the podcast today, that you'll soon see, this needs to be, and it was Ian's idea, so credit is due to you. This needs to be on Netflix. This needs to be a documentary. This needs to go way beyond a book that was written by 28 co-collaborators. Everyone needs to hear, see, and experience this message, because the content that each of you provided is so outstanding and your messaging is so important that on our part, Dina and I are so pleased to have had the opportunity to work with you on this. And we can't wait to see all of you on the big screen.